All right, first up this morning, taking your meds. Studies show that about half of people with chronic conditions do not take their medications as prescribed. This can be very serious, even deadly.
That's right. And if you've got trouble keeping track of what medicine is due to be refilled and when, well, we may have the perfect solution for you. Omar Aliwa is a pharmacist, compounder, and owner of Welltopia Pharmacy, and they've come up with a foolproof process. It's called All In One. He's going to explain it. Good morning, Omar.
Good morning, Tiffany. How are you doing today?
Good to see you. It's so nice that you're joining both of us today. I know you're standing by the machine, and you're going to show us that in a little bit and how it works. But let's talk a little bit about medication and what it means to be adherence to medication.
Great. So adherence simply is like the extent to which you would be taking your medication, following a specific diet, or implementing life changes, like implementing lifestyle changes. Then we're going to have outcomes. So we have therapy, adherence, outcomes. If there is no adherence, the outcomes are not going to be as expected.
Yeah, that makes sense. And Omar, there are certain chronic conditions that I think are quite common, things like high blood pressure as well as diabetes. If you're not taking your medication as prescribed and you're not adhering to that schedule as doctors order, then you could have real problems, right?
Exactly. So let's say there's billions of dollars spent to come out with results that say antihypertensive medications decrease the incidence of stroke by 30%. But this is for adherent patients. Question to the patient or the consumer, are you actually taking the medication every day in 30-day cycle or 90-day cycle every single day, or you're missing like 10 days, 15 days? And how is this going to affect the health outcomes? Actually, the WHO said in 2003 in a very strong statement that the outcomes from medication adherence have greater, bigger results than specific medical interventions by themselves, like having a surgery or just trying this new drug. Actually, the adherence to the medications that are safe and efficacious, if you take them as prescribed, you're going to have bigger impact on better outcomes for your health. And that's what we try to focus on at Welltopia, to make sure that you take your medications, pills and capsules according to a plan, that the doctors know about it. All of your doctors, not just one doctor, but you may be going to several of them.
That's true. And if you're missing just one here and there, like you said, that percentage of getting the results that you want can go way down and have some really adverse effects. So talk about the all-in-one and exactly how you're helping people, what that machine is and how it works.
So to give you an example, a typical Medicare patient, 65 years and older, would be going in 1 year to 7 doctors. 5 of them are specialists, 2 general practitioners. We get what we call complex medication regimen. You have to take several pills and capsules every day. Maybe there's an inhaler, maybe there's insulin. And then the question is going to be, how are you going to arrange all of that? This is where adherence falls in place. So with All In One Welltopia, what we do, it is not just a gadget, not just a box that I give you or like a pill that you take. Actually, it's full service of health coaches and pharmacists. We call you every month, 7 days ahead of the time, to check with you. Did you visit a doctor this month? Do you have new prescriptions? Did anything happen? Did you go to the hospital? We are noticing that you're not taking your inhaler. You haven't filled your scheduled inhaler for the last couple of months. What's going on? So we chat with you. There is a built relationship with patients because the average number of times you call the pharmacy is 33 times in 1 year. So we have a relationship. We deal with you as family. So now we know what's happening, what's going on. Now we can deliver to you the box, okay, that contains your easy open packets, a free service. Or maybe this is not suitable for you. Maybe you don't like it. So we give you vials and we monitor that. So All In One Welltopia is more of a concept for simplifying medications. And for patients with chronic conditions, simplifying medications is simplifying life. Just yesterday, Molly, we had a patient who takes medications 8 times in 1 day. A psychiatric patient. The father has to take care of him. When we offered him All In One Welltopia, he couldn't believe it. He said, "Oh my God, you're just going to take it off my burden. Now maybe I can get back to work."
That's amazing, Omar.
That.
And I want to just clarify, so the all-in-one, what you're saying with those little blister packs, is instead of, if people choose this, instead of all those pill vials and having to count it out and put it in something each day, it's actually like pre-wrapped like that, and it lists what your medication is. So then you just take that blister pack, open it at your scheduled time, and take all your medications at once.
So
yes,
simple.
Exactly. Welltopia Pharmacy prepared my pack beginning of the month. So now I have my 3 supplements that I take in the morning. I'm waiting to eat breakfast and take them. I have them with me. I keep them in my pocket. And then when it's time for me to take them, so I take them. So yeah, it's as simple as having all of your meds and supplements in an easy open packet. It's free service.
And really quick, Omar, is there an extra charge to have the all-in-one, to have you blister pack supplements and medications?
No, actually, we try to make it as simple as it can be. So you just pay for your co-payments, you pay for the price of the supplements we put inside. If you have supply of meds and supplements and you cannot come to the pharmacy for any reason, we're going to send a courier to you and have you bring those to us without you leaving your house. We understand that with COVID-19, a lot of high-risk patients don't want to leave the house. So we're going to send someone to you or send you a prepaid mail. So if you have like supply of your medications and supplements, we can take it, and then we're going to contact you and see what's the best way to deliver the service.
Love it. And we're out of time, Omar, but just real quick, how does someone transfer to you? Is that easy?
We added a very new feature to the website. You can go to the website now, welltopiarx.com. On top, there is Easy Transfer tab. Click on it. It's going to guide you towards sending us your information. We will contact you, contact your pharmacy, and boom, within a few days, you have the all-in-one Welltopia at your doorstep.
That is fantastic,
So
Omar. Thank you so much for that information. We're going to tell people how to subscribe.
Good to see you, Omar.
Thank you so much, Molly. Good to see you, Alice.
Yeah, good to see you too. And here's the deal. You can subscribe now to All in One Welltopia service. You'll earn a free consultation and an excellent vitamin supplement recommendation as well. So just go to welltopiarx.com, click on All in One, then fill out your information, and the pharmacy will reach out to you to guide you through the process. You can also call or text this number. It's 262-429-9429.